healthcare industry isn't designed to make you healthy. It's designed to make money. And if that sounds dramatic, good. Because most people still believe the healthcare system exists primarily to cure disease, like some giant humanitarian Avengers team where everybody wakes up every morning thinking, how do we save Bob from Ohio today? But that's not what the incentives say. And in America specifically, healthcare has quietly transformed into one of the largest wealth extraction machines ever created. Bigger than oil, bigger than defense, bigger than the GDP of most countries. And the craziest part? The sicker the population gets, the more profitable the system becomes. Which is not exactly comforting. Because modern healthcare isn't structured around prevention. It's structured around recurring revenue. And once you see how the incentives actually work, you can't unsee it. It's like learning how magicians do tricks. Except instead of rabbits disappearing, it's your bank account. Think about it like this. Imagine you owned a car repair shop. Now imagine your profits depended not on fixing cars permanently, but on making sure customers came back every single month with new problems. Suddenly your mechanic starts looking at your engine like a Netflix subscription. Oh yeah, we fixed the brakes, but unfortunately your steering wheel now has anxiety. You don't want perfectly functioning cars. You want maintenance cycles, endless diagnostics, subscription repairs, premium oil packages with enhanced wellness technology. And that's dangerously close to how modern healthcare operates. Because curing people permanently is often terrible business. Now, before the comment section turns into a digital civil war, this doesn't mean doctors are evil. Most doctors genuinely want to help people. They spend years in school surviving on caffeine, stress, and approximately 4 hours of sleep a week. The problem isn't usually the individual doctor. It's the financial system surrounding them. Insurance companies, pharmaceutical giants, hospital corporations, private equity firms, medical device manufacturers. Those incentives are financial first, health second. And this matters because the numbers are absolutely insane. The United States spends over $5 trillion a year on healthcare. That's around 18% of the entire economy. To put that into perspective, if American healthcare became its own country, it would immediately become one of the richest nations on Earth.
Think about diabetes. In a healthy system, you'd want diabetes rates going down over time. But financially, a lifelong diabetic patient is incredibly valuable. Recurring insulin purchases, recurring doctor visits, recurring blood testing, recurring insurance billing, recurring complications later in life. That's predictable recurring revenue. And Wall Street absolutely loves recurring revenue. Investors hear the phrase lifetime customer value and start levitating slightly above their chairs. And that's why pharmaceutical companies don't necessarily get rewarded for eliminating customers permanently. They get rewarded for maintaining long-term treatment pipelines. Now, obviously, modern medicine has done incredible things. Antibiotics, surgery, trauma care, vaccines. We are not pretending medicine itself is fake. If you get hit by a truck, modern healthcare is fantastic. Nobody wants medieval healthcare. Sorry, sir, the local barber will now remove your leg with a spoon. But financially speaking, industry's most valuable customers are often the ones who stay sick the longest. And once you understand that, a lot of modern healthcare suddenly starts making uncomfortable amounts of sense. Like why preventive healthcare receives comparatively little attention. Prevention is hard to monetize consistently. Telling people to sleep better, exercise, reduce stress, and eat healthier doesn't generate explosive quarterly earnings. But treatment scales beautifully. It's much easier to bill insurance companies for expensive procedures than it is to help millions of people avoid getting sick in the first place. One generates immediate cash flow. The other reduces future demand. And public corporations are rewarded based on growth.
Now watch what happens when private equity enters healthcare, because somehow the situation becomes even more dystopian. Private equity firms realized something very important a few years ago. People continue getting sick during recessions, which makes healthcare one of the most reliable cash flow industries imaginable. So firms started aggressively buying hospitals, nursing homes, emergency clinics, dental chains, even veterinary clinics. Apparently even your golden retriever isn't safe from leveraged buyouts anymore. And once private equity acquires a healthcare company, the playbook usually looks the same. Cut staffing, increase patient volume, raise prices, maximize billable procedures, reduce operational costs, extract as much cash flow as humanly possible. Because to financial engineers, patients often look less like people and more like revenue units with pulse rates.
And the data behind this is honestly disturbing. Some studies show hospitals acquired by private equity experience staffing shortages, worse patient outcomes, and higher costs. But from an investor perspective, the model often works because healthcare has one enormous advantage economically: inelastic demand. If your appendix explodes, you're not sitting there comparing Yelp reviews. This hospital has great surgeons, but only 3.8 stars because parking was bad. No, you're trapped. And people will pay almost anything when survival is involved. Now, let's talk about insurance companies, because this is where the average person's remaining sanity usually disappears completely. Insurance companies make money in one very specific way: collecting more premiums than they pay out in claims, which means every denied claim can improve profitability. Every delayed approval can improve margins. Every rejected treatment reduces costs. Now, to be fair, some oversight absolutely matters. Fraud exists, unnecessary procedures exist, but the financial structure still creates a deeply weird relationship where the customer needing medical help becomes financially adversarial to the company supposedly protecting them. Think about how absurd that is.
You pay a company every month for protection. Then when something terrible happens, both sides suddenly enter a bureaucratic cage fight over whether your organs are technically in-network. And that's why people constantly feel trapped inside paperwork hell. Prior authorizations, coverage denials, network restrictions, surprise billing, 3-hour customer support calls that somehow end with less clarity than when you started.
Some point, you don't even feel sick anymore. You feel like you're trapped inside an Excel spreadsheet. And the complexity itself becomes part of the business model, because confused customers are easier to overcharge. Now, layer pharmaceutical companies on top of this. The pharmaceutical industry is one of the most profitable industries on Earth. Again, this doesn't mean medicine is bad. Plenty of drugs genuinely save lives. But pharma companies are still corporations, operating under shareholder capitalism. Their legal responsibility is maximizing returns. And that creates some very strange outcomes. For example, America allows direct-to-consumer pharmaceutical advertising at massive scale, which means you can literally sit on your couch eating microwave pizza while watching commercials telling you to ask your doctor if this medication is right for you. The ad always starts with somebody running through a field, smiling for absolutely no reason. Then the side effects arrive. May cause dizziness, nausea, organ failure, spontaneous combustion, or death. And the actor is still smiling. Imagine if every industry advertised like this. Ask your financial advisor if bankruptcy is right for you. And here's where the incentives get even stranger. Investors don't just reward successful treatments, they reward scalable, recurring treatments.
That's why weight loss drugs became one of the hottest Wall Street trades in years. Not because hedge funds suddenly became passionate about public wellness, but because obesity represents one of the largest recurring medical markets in existence. Millions of long-term customers. Again, useful medication can absolutely exist while financial incentives simultaneously distort behavior. Both things can be true at once. Now let's talk about hospitals. Most people imagine hospitals as purely humanitarian institutions. Many modern hospital systems operate more like giant corporations with expansion goals, executive bonuses, real estate strategies, and aggressive revenue targets. Some non-profit hospitals generate billions annually while still aggressively chasing patients over unpaid medical debt. Which is a little confusing, because when most people hear non-profit, they imagine kindness and community support, not congratulations, your ambulance ride now costs more than a used Toyota Corolla. And hospital pricing itself often feels completely detached from reality. An aspirin inside a hospital can cost absurd amounts. A routine procedure suddenly generates a 5-figure bill. Nobody knows prices beforehand because healthcare pricing is intentionally opaque.
Imagine going to a restaurant where the menu has no prices, the waiter refuses to answer questions, and 2 weeks later you receive a bill equal to a small mortgage payment. That's basically American healthcare. And opacity matters because transparent pricing creates competition. Hidden pricing destroys it. But underneath this entire machine sits the real economic engine: chronic disease, heart disease, diabetes, obesity, hypertension, anxiety, depression, autoimmune disorders. These aren't short-term illnesses. They're recurring economic ecosystems. Entire industries now depend on managing long-term conditions at scale. And again, many chronic illnesses are genuinely difficult to solve completely. Human biology is extremely complicated. But financially speaking, management is often more profitable than elimination.
That's the incentive problem. Now, combine this with the modern food industry. Ultra-processed food companies engineer products for taste, convenience, addiction, and shelf life. Healthcare companies then profit treating the downstream consequences. One industry creates unhealthy consumption patterns. Another monetizes the resulting illness. And sometimes the same institutional investors own both companies, which sounds like satire, but it's not.
Now, here's where this becomes bigger than healthcare itself. When healthcare costs explode, the entire economy starts bending around it. Employers pay higher insurance costs. Workers receive lower real wages. Families avoid preventative care because they're afraid of bills. Young people delay having children. Small businesses struggle offering benefits. Government debt rises. Healthcare inflation quietly spreads through society like financial mold. And meanwhile, the average person feels completely powerless because healthcare pricing is incomprehensible. Insurance contracts are incomprehensible. Medical billing codes are incomprehensible. Most people don't even know what they're paying for until a bill arrives looking like it was generated by an angry calculator. And when industries become too complicated for normal people to understand, power concentrates at the top. Now, here's the part mainstream conversations almost never focus on. Incentives shape behavior more than intentions. You can fill a system with good people and still produce bad outcomes if the incentives reward extraction over prevention. Because systems optimize around money flows. And healthcare isn't unique here. Social media optimizes for attention. Fast food optimizes for cravings. Banking optimizes for debt expansion. But healthcare feels uniquely disturbing because human suffering is directly involved. Now, to be clear, this doesn't mean every hospital is corrupt or every pharmaceutical company is evil. Reality is more complicated than internet outrage makes it seem. Modern medicine genuinely saves millions of lives every year. But simultaneously, economic structure surrounding healthcare creates powerful incentives prioritizing revenue growth over long-term public health outcomes. And you can literally see this contradiction happening in real time. America has some of the most advanced medical technology on Earth while simultaneously struggling with enormous chronic disease burdens. It's like building the world's greatest fire department while continuously pouring gasoline across the city. The treatment system becomes incredibly advanced while prevention stays weak. Because prevention is slow, prevention is boring, prevention doesn't make headlines. But chronic treatment generates recurring quarterly revenue forever. And this is where investors become extremely important again. Wall Street values healthcare companies partly based on future cash flows. Analysts project future prescription demand, future procedures, future insurance enrollment, future treatment expansion. Entire stock valuations depend on assumptions that healthcare spending will continue rising for decades. Think about how insane that feedback loop really is. Financial markets are literally pricing future sickness into economic growth models. And this is why healthcare stocks are often considered defensive investments. Because unfortunately, illness doesn't care whether the economy is booming or collapsing. Now add aging populations into the equation. As populations age, healthcare demand rises dramatically. More medication, more procedures, more long-term care, more recurring treatment. And investors know this. That's why healthcare is increasingly viewed not just as medicine, but as demographic monetization, which is a horrifying phrase that somehow still exists in actual finance conversations. And then there's medical debt. Millions of Americans delay care because they fear costs. Others survive emergencies only to spend years drowning in bills afterward.
Imagine surviving a heart attack and then immediately entering a side quest fighting insurance paperwork for the next 18 months. That's not healthcare security. That's economic trauma with co-payments. And the stress itself often creates even more health problems. Now here's the really dangerous part. When healthcare becomes primarily profit optimized, trust starts collapsing. People begin distrusting insurance companies, distrusting pharmaceutical companies, distrusting institutions, distrusting public health messaging, sometimes even distrusting doctors themselves. And once trust collapses inside healthcare systems, society becomes extremely unstable. Because functioning healthcare depends heavily on institutional trust. Trust erodes when people increasingly feel less like patients and more like monetized subscription plans with needs. Now, none of this means profit and healthcare can never coexist. Innovation absolutely requires financial incentives sometimes. Drug development is expensive. Research is expensive. Building advanced medical infrastructure is expensive. But the problem starts when maximizing shareholder value becomes the dominant organizing principle behind healthcare itself.
because shareholders benefit from growing revenue streams. And healthy populations often reduce revenue streams. That's the contradiction nobody wants to confront directly. And that's also why healthcare reform conversations rarely go anywhere politically. Because the amount of money tied to the current system is enormous. Insurance companies, pharmaceutical companies, hospital systems, lobbyists, investors, politicians, entire financial ecosystems depend on healthcare spending continuing to rise. The machine is massive. And once industries become this economically important, they gain political gravity. They influence regulation, media narratives, public policy. They become too financially embedded to disrupt aggressively. So instead, the system keeps expanding.
Higher costs, more subscriptions, more complexity, more medication management, more administrative overhead, more financial extraction hidden behind the language of care. And the craziest part? Most people still think healthcare is primarily about health. But if you follow the incentives, follow the money flows, and follow institutional behavior, a much darker picture starts emerging. Healthcare isn't just medicine anymore. It's one of the largest monetization systems ever built. And here's great news: subscribe button is absolutely free. Tap it now and don't forget to like and subscribe.